Hey, welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, February 23rd, 2026, 2/6. Today, I am joined by Ruthie, who's going to tell her birth story. Ruthie is a physician assistant who works in hematology oncology in New York. She experienced postpartum depression after the birth of both of her daughters, and she is passionate about sharing her journey openly in the hopes of helping other mothers feel less alone. Ruthie was referred to this podcast by Gabrielle Moskovitz, who you may all recall was a guest on this podcast in 2024 and is a friend of the podcast and a friend of mine. Thank you, Ruthie, for sharing your important story with all of us. All right, thanks for listening. See y'all next week. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. Ruthie, welcome to the podcast. How you doing today?
I'm great. Thank you so much for having me.
So this is very exciting. I love when people volunteer to tell their stories, and you reached out through a mutual friend and said that you wanted to tell your story, which I really appreciate. And I just want to start off with why? Why did you reach out?
Yeah. I mean, first of all, shout out to Gabrielle, because if I didn't give her a shout out, I'm sure I will not hear the end of it.
She is a force of nature. I hear you. Okay.
She's going to love this. I mean, it was mostly her idea, but also honestly, I just felt that unfortunately, the discussion of postpartum depression and just maternal mental health in general is really not spoken about as much as it can and should be. And slowly over time, I've just become more comfortable sharing my story and in the hopes that other people can relate and just to normalize it and feel less alone. And that's why I'm here.
Well, I really appreciate it. I agree with you. I think anyone who listens to the podcast would say, obviously, I agree with you on that. That's just such a huge topic that does not get talked about as much as it should, related to pregnancy and delivery and the health of the mother. People always think, of the physical health, let's say, but they really either don't appreciate or don't want to appreciate how significant mental health is before, during, and after pregnancy, and how it's not a given that it's going to go okay, even for people without a history of any issues with mental health. And I don't know, I really still don't understand why people don't talk about it as much, if it's because of a stigma maybe, or just they're uncomfortable in general about mental health. But that's the reality. People don't talk about it as much as they should.
Yeah, for sure. I don't know. I feel like we as a society, I guess, have done a better job about talking about it a little bit, stigma wise, in comparison to, let's say, my parents' generation, or even my grandparents, where it was just oh, baby blues, or, it's really hard after you give birth, or things like that. And now we're kind of more so naming it and discussing it, but there's for sure work to be done, and it's an ongoing battle. And
it's interesting is I agree. I mean, I think of what my peers are like and what we were like when we were having kids, and obviously my parents' generation. But when I look at my kids' generation, I think in general, mental health is discussed much more. Meaning kids nowadays are much more open about mental health, about their own mental health, issues, about their friends. They're able to talk about it. They have sort of a language around it. People aren't, there's so much less shame about the idea of seeing a therapist or taking medications or whatever it is. And I agree that we've gotten so much better, but I don't know how much that's translated into maternal mental health, postpartum, let's say specifically. I think a lot of these same kids, when they become young adults and they start having kids, I just see that something shifts. And maybe it's just because they feel well, now that I'm having a kid, it should be different. And I don't know, but I'm not sure if it's translated as well into this arena as it has in sort of general mental health. I'm not sure. Have you seen that yourself?
Yeah. I mean, I hear what you're saying. I feel like it's a lot of, like I said, there's a lot of work to for sure be done. I think the word that like comes to mind for me is the like should, which like I feel like is used a lot. Not that I'm a therapist, but like used a lot in therapy of like, especially when it comes to being a mom, let's say, like I should love my baby right away. I should feel connected. I should, X, Y, and Z. So I feel like a lot of that is still like work to be done when it comes to, when it comes to becoming a mom and like mental health in that capacity, like specifically for sure.
Yeah, I think that's really insightful. I guess, for kids, let's say you're a teenager or whatever it is, and you're struggling with anxiety or depression or, whatever. I don't think teenagers are maybe to the same prevalence. So like, I should, have great, social interactions and I should feel good every day. Maybe they do, but I think it's not the same weight as having a baby. Like, oh my God, I'm having a baby. I should be perfect at this. I should, be super mom. I should be really connected with my baby and, want to do this again as soon as humanly possible. And I just think that for whatever reason, those expectations, whether they're external put on people or whether just internal people put on themselves, are very weighty and come, head to head with mental health all the time.
Yeah, I think that's also a really good point. Just like that extra layer of responsibility. I think when you become a parent of like, you're caring for yourself as, let's say, like you said, a team, like I don't know, make good grades. I should be invited to parties or whatever. And now it's like, all of a sudden there's like this external being that you and your partner have like a shared responsibility for. But yeah, you feel this extra weight of like you said, needing to be like super mom and be able to do it all and provide for them.
Wow. So really great intro to what we're going to talk about. I guess before we begin with your story, maybe just give our listeners a sense of, who you are, what you do, I don't know, where you're from, those types of things. Just, overview of Ruthie.
Sure. So I'm Ruthie, 30 years old. I'm originally from Long Island and I now live in Jersey. I've been working as a PA in New York City Hospital for the past 2 and a bit years, minus some maternity leave. I specialize in hematology oncology. And yeah, I'm a mom also. And I have 2 girls. I have, it's crazy to think about, but an almost 4.5-year-old named Kira and my baby who's going to be 1 next week. Wow. That's just weird to like wrap my head around.
Fair. All right. Excellent. And you're married. And what does your husband do?
Yes. Forgot about my husband.
No, you didn't.
Sorry.
I interrupted you to bring him to the forefront, but you definitely didn't forget about him.
No, he's going to come up probably a lot throughout this also. So my husband's name is Ari. We met like almost 10 years ago at this point. We've been married for 8 years and he works as an actuarial analyst in healthcare.
Cool.
So we're both, healthcare people. Opposite sides, I guess, technically, but
opposite sides of the team. All right. I understand.
A little bit. Yeah.
So I guess knowing that background, tell us about where you were in life coming into your pregnancy, your first pregnancy with Kira, and then how that pregnancy itself went.
Yeah. So I had like a little bit of history of like mental health stuff when I was in my like early 20s. So I, in the back of my head, thought, I heard of postpartum depression, knew it was a possibility. It's fairly common. So I was in PA school. We kind of got, delayed because of COVID.
Mm-hmm.
We were supposed to graduate, I believe it was the end of 2020. Yes. Okay. So when we started rotations literally January 2020. And I remember, it was excellent timing. And then around March, when the pandemic essentially hit, our program didn't necessarily like remove us from our rotations. We kind of just like started dropping like flies. And then I think by like April, once they realized, what was going on, we kind of had to like be delayed. I think we went back maybe like June. And then once there was more of like a clear end in sight, we started talking about like me and my husband started talking about like wanting to start a family. Been married for, at that point, like over 3 years. And, I was finishing up school, I was going to start working. And yeah, so we decided like we would start trying. Thank God, got pregnant fairly quickly. Didn't have complications with that. And then overall, I was feeling okay. I found out I was pregnant like November of 2020, I want to say. And I had maybe like, I don't know, 1 or 2 rotations left. We ended up graduating around like March time via Zoom because that was the world at the time. And I took my boards in June. Yeah, I took my boards in June. And so Kira was born at the end of July. Granted, in May, so during, I guess that would be my 3rd trimester, I started to feel, I want to say like off a little bit, but I just chalked it up to, like I'm studying to take my boards to be certified as a PA. And, I am a little bit scared to become a mom and the change that comes with it. But it kind of just slowly became more and more of a like, this isn't me and something feels wrong and I don't know exactly what. And then, it kind of just, even after I gave birth, the first couple of weeks are kind of just a blur, I think, for anybody. And, no sleep, you're just like a whole shift of identity. And in the beginning, I was just like, okay, like we're literally in the trenches here. Just get through this and I'll get used to it and everything will be fine.
When you were pregnant, you said that in your past, you had sort of a history of mental health issues, so to speak. Was it something you thought about during your pregnancy? Like, hey, I'm at risk for this, or, I need to be mindful of this, or something you spoke about with your OB? Or was it sort of something in the past for you that you didn't even think to talk about it during the course of the pregnancy until maybe the very end?
No, so I even like beforehand, I remember going and speaking to the OB and saying like, I know the facts here. I know I'm at risk. What's the story with like, for instance, taking medication? Like I know different OBs have different, approaches, more conservative or, and I was on medicine. I was on medication during pregnancy. So I had a therapist.
And so the OB was supportive of that?
Yes.
Oh,
yes.
Okay. Got it. Great. All right.
Which is great.
So after you delivered, how soon did you realize this is going downhill?
I think it's hard to say, like to pinpoint exactly. And I even remember like for this second pregnancy, trying to like use the data, if you will, of like pinpoint when exactly things happened. I think if I remember correctly, also Ari was like, kind of able to tell more easily as like an external person watching in. Because when you're the one going through it, it's hard to really tease out exactly what's happening and what's in your mind versus reality, unfortunately. So I think it was also, he had, if I'm not mistaken, like 6 weeks of paternity leave, both times around, because he was out in the same job. And, those first 6 weeks, he was also there with me. It was just the two of us with the baby. Amazing. Like, he was able to do the night stuff for me and give me a break. And then I think at first I thought it was just, similarly, like the anticipation of him going back to work. And then, at that point I had taken my boards, but I wasn't, actively job searching yet because I just had a baby. And the reality hit me of like, oh, okay, this is me and Kira, and until when, like what's like the next step here? So I would say roughly around like the 8 to 12 week mark, give or take.
And were you sharing any of this with anybody else in your life, or was it just you and Ari and your therapist?
So at that point, I also like got my parents involved because we needed help. Honestly, it was, I think ahead of time, at the time we were living in an apartment in the city, and the plan was always to go to my parents after I gave birth for like a week or two. Just, they had a house, they had the space, I feel like typically that's a lot of people do that. So that's what we did. And then it was kind of like we went back to the apartment and things were just not going great. And, my parents were, very involved. So, they kind of knew what was going on. But I don't know if anybody really fully grasped the extent of it at the time, like right when it was happening. It was kind of just a similar situation. Like maybe this is just your typical postpartum and it needs to run its course, or, it's kind of like not 100% clear what was going on.
Right. So I guess if you could explain to our listeners sort of from your experience, like I can imagine some listeners thinking, well, what was happening? How was it different from quote unquote typical, right? Either those listening who've had children or haven't yet had children. So how would you explain to someone like what was going on with you and your mental health that was different, that was worse, that was really not well? Like, how would you explain it to others, like tangibly? What was happening?
Yeah. And it's hard because sometimes they kind of blend together, like the two experiences. And also I feel like the brain does a creepily good job of like erasing a lot.
Like the whole COVID experience. I don't remember any of it, but yeah.
Yeah. No, for real though. It's like, there's times where I'm just thinking back, like randomly thoughts will come to me, or, my dad will say like, do you remember when this happened? And I'm just like, no, it's a little scary, honestly. Like I genuinely don't remember like all the details, which I guess is a blessing in disguise, if you will. But yeah, I mean, it was your run-of-the-mill depression symptoms of not wanting to get out of bed, not wanting to eat, not wanting to see people. I mean, my husband like took the brunt of the nights. He did all of the night feeds. I wouldn't get up in the middle of the night with him. He just fed her. And I mean, in hindsight, I did have the foresight, I guess, to know that maybe something like this would happen. And, the decision was made not to breastfeed. And I'm happy that we made that decision, because that also, like, not sure how that would have played out, had it been like solely on me and he wouldn't have been able to help. But yeah, I think just like a general disinterest in things. I remember it was interesting though, because, there was a lot of comparison, which was hard kind of this time around with Leora, because I don't know if I was like hyper vigilant because, I had gone through it the first time. And this time around, it's like, okay, am I expecting this to happen again? Am I thinking that it's happening without it actually happening, like overthinking it? And with Leora, like I actually, thank God, like during my third trimester felt totally fine. So there was a small part of me that was like, you're in the clear. Like this may not happen again. And, it didn't have to happen again.
Right.
So, yeah.
So when this was going on with Kira, how long did that go on for? Where you were really not doing well? Are we talking days, weeks, months?
Yeah. It was like on and off, it's not, that's also like the process is so not linear, which does not particularly help, because you have a day where you're like, oh, I actually feel like me again. And look, I am getting up and doing things. And then, a day or two later, you could just be back to, never mind. I don't actually want to do this anymore. But with Kira, I remember it was also amidst like all the Jewish holidays. So we were just kind of like, because she was born in July, Ari was off for all of August. And then at that point, you were heading into September. And we kind of were just going back and forth between our apartment and my parents' house because it was all the holidays. So I think by the time, and that's just like not a regular routine extra hands around. And it just was like, we weren't back in our apartment. So I think it was more by the end of that, she was already, I don't know, like going on like 3 or 4 months when it was like, okay, something needs to be done. This can't keep going on.
And when you say something needs to be done, what was it? They changed your medication or increased it or something?
So no, actually I have another shout out. I'm not going to say the person's name though, but somebody in the community at the time who dropped off like a meal early on. So, like a week or two after I had given birth, said to me like, you seem fine. And I'm not trying to insinuate that anything is wrong, but I just want you to know that there are resources and there's like an amazing place called the Motherhood Center of New York if you ever do need it. And that kind of stuck with me in the back of my head. And when, down the line, heading into September, October time, when, it was still not amazing and we were like, okay, something needs to be done. Ari reminded me, he's like, do you remember that place, that girl mentioned, that maybe we should look into that and see exactly like what that entails and if that's helpful or not.
Wow. And so after you went there, really things changed.
Yeah. So we got in touch with them. I obviously begrudgingly at the time because I was, like, I don't want to have to do any extra intervention. In my head, I was like, we'll just let it run its course. I'll keep taking my medication, keep doing therapy. But at a certain point, it kind of just, I wasn't cutting it, So we reached out to them and they had like an intake session with me, and they have an amazing program called like their day program. So they have a bunch of different layers to them. They have regular just outpatient therapy. They also have like an amazing program called, I think they call it their day program, where it's more intensive, if you will. And it's Monday through Friday. And basically it's just more like a higher level of care for people who needed it. And I remember thinking at the time, like, I don't need this, which obviously I was in denial. And, I obviously did need it.
Yeah.
And normally it's in person. And for Leora, I did have to go back and I did it in person. But with Kira, it was 2021. So it was like still kind of COVID times, and maybe it was the next strain of COVID. Honestly, I don't even remember, but that was virtual.
Mm-hmm.
So the amazing thing about the in-person though, is that they have a nursery on site also.
Oh, so you could bring your baby.
So yeah. So like this time around with Leora, I knew, I had someone to give me a break also. They had, yeah. And that was like an amazing resource also that I actually didn't know about the first time around because everything was on Zoom. Yeah. So there was, there wasn't like a Zoom nursery. But for this time around, when I went with Leora, it was amazing.
Yeah. I mean, the Motherhood Center is not sponsoring this podcast, but I will say that we work with them a lot, and there's a lot of really terrific places in our area, but the Motherhood Center is certainly one of them. They're really, really great. So that's amazing. So knowing this and that this happened and, everything you went through when you were coming up to your second pregnancy with Leora, number one, how hesitant were you to do it again, right? To go into pregnancy. And then number two, you obviously did it, right? Because you have another kid. During the pregnancy, how fearful were you that it was going to happen again?
Yeah, all very valid questions. It was a decision. Like Ari and I had to, sit down and obviously talk about it. We waited, Kira was already, I think she was almost 3 or maybe by the time Leora was born, she was already 3.5. But even just talking about like, trying again, and it was benefit versus risk, honestly, of like, yeah, there was a small part of me that's like, maybe in an ideal world, like this won't happen again, or it won't be as bad, or I'll have the tools, you know, from last time, which essentially we did, meaning, you know, we reached out to the Motherhood Center when Leora was like 6 weeks old, because it was just, you know, in comparison to the first time around where she was 3 going on 4 months, and we were kind of like, you know, scrambling for help. So, but it was, I wanted, you know, growing up, I had 2 siblings, Ari's one of 4, and I think we just felt that, you know, we wanted to give Kira a sibling, and it wasn't a decision that we made lightly. And like I said earlier, I really had, like, I don't want to say false hope, but when I didn't have symptoms in my 3rd trimester, you know, I was at work. I worked until she was due in January, and I ended up having her on the 29th, and I was working on Christmas. I remember, which was crazy because I also like literally could not move or walk, but we were like short staffed, and I was like, I can't leave them. But yeah, I think we just felt like this is what we want to do. And, you know, I think actually I was probably more on board than Ari was, which makes sense. Like,
totally.
That's also like
he had to see you go through this. That's awful to see a loved one go through this.
For sure. And also for him, like, you know, having to literally carry the burden. You know, and he, like I said earlier, you know, your brain compensates by kind of making you forget things. And he didn't forget, you know, he remembered all the details and everything that we went through, and, you know, had to be actively on board to say, okay, like I'm willing to do this again so that I can have 2 kids, you know?
It's, you know, it's really amazing. And I'm going to give you a shout out right now, whether it embarrasses you or not. You know, in this world, you know, when a lot of people have kids, obviously, and if someone has something that's obvious that's going on in their life, you know, they have they're in a wheelchair, whatever it is, right? Or they have some sort of like physical ailment or some sort of condition, and they get pregnant, they go through pregnancy, and everyone's like, oh my God, like what a warrior, like unbelievable, you know, like so amazing. And everyone's just like marveling at the fact that this couple had a kid despite these challenges. But you don't get that, you know, like nobody knows how hard it is for you to make a decision to have another kid and to go through that pregnancy. And it's the exact same sort of thing. Obviously it's different because of what we're talking about, but it's the same concept that, you know, you're also the warrior who decided I'm going to do this. And despite knowing that likely I'm going to have a really tough time, I might be a wreck during pregnancy and postpartum. It's going to affect me. It's going to affect my husband, but I want to do this. I want to have another kid. Like, that's like awesome that you did that again, knowing how hard it was going to be, and that you came through on the other side. And that's just really, really impressive. You know, I do this for a living, and I see people who, you know, do this all the time and under different circumstances, obviously. But I feel that those who know that they're going to have mental health challenges just don't get the shout out that they deserve for doing that. So there you go. You got it on the air.
Thank you.
You got it on the air.
You can't see me, but I'm smiling. I thank you. I mean, you raised also a really good point of just like, and I always say this, like, you know, someone with a broken leg, it's not that their issue is more important and less important. It's visible to everybody. You know, someone on the subway is going to see them having trouble getting on and off, and it's like, oh, this person needs help, let me help them. Versus like,
or they won't help. This is New York, so I don't know. Right. Fair. But, you know, someone with like, unfortunately, like mental illness, it's invisible. You can be walking around, and I like was not so public about it, and like slowly and becoming a little bit more, you know, comfortable sharing. And I've had people reach out to me and they're like, I had no idea. Yeah.
And I'm like, because, well, why would you? You know, it's like you see, let's say like on Instagram, and it's like, oh, wow, like what a cute baby. And look, like Leora is 2 months old. And oh my gosh, must be so nice. Like they have a beautiful family and it's all these things. And like, you just have no idea, what's going on behind closed doors, or like you said, what people have gone through to get there, whether it is mental or, physical or infertility or any of these things. It's so not spoken about, and it's invisible. It really is.
Yeah. And it's also, I think, A, it's not spoken about, but B, let's say someone did, tell everyone, hey, I had a baby. And by the way, I have really bad postpartum depression. Just want to let you know. I think most people still wouldn't know what to make of that. Right.
Yeah.
Because even though let's say it's being spoken about, they're like, do I drop off a casserole for that? Like what, like what's the protocol?
Right.
And I think people just don't know how to interact, even those who are very well intentioned, obviously. So I guess to get practical for people listening, if let's say they know someone who has a history of mental health, issues, or they know that postpartum depression or anxiety is, how could they be helpful? Meaning, if you could go back, how could people have been helpful to you had you told them about it, and had they known, and had they wanted to, help you in any way possible? Like, what would have been useful?
It's like one of those where the question is so much better than the answer. I think.
I doubt that. We'll wait for your answer and then we'll decide.
I'll try. Honestly, I also I can only speak for myself.
Sure, that's fair.
You could have someone else that's going through it and doesn't want anybody to reach out to them.
Yeah.
And I have a couple of close friends who, thank God, are very supportive, and they know both times like what I went through. And I just remember getting texts or messages that are just like someone knowing that someone's there. Like, I'm here. You want to talk? You don't want to talk? Like, I'm here. Or just, I think sometimes not talking about it and just talking about normal things that, we would talk about otherwise. Like, I had a friend that just texted, if we listen to a specific podcast, like, hey, did you see a new podcast just dropped? And that's why I'm saying for different people, it's different. Someone else might think, oh, we're just not acknowledging the elephant in the room. But I think it depends, it depends on the person and their friends and their family, and how they can best show up to support them. But for me, I had a friend who actually had a baby this year, and, for her, knowing, thank God she didn't experience anywhere near what I did, but knowing that she had someone in her corner that went through, something as big as I did, and just being able to know that I was there as a resource and just a sounding board, where it's she gets it. She literally went through it, and just having that. I think really at the end of the day, it's just knowing that they're there for you in whatever capacity works best.
You mentioned at the very beginning of this podcast that over time, the past years, you've become more open about your story and what happened to you and sort of what you went through. So I'm going to ask two questions about that. The first is, why? What is it that made you want to be more open about it? And the second question I'm going to ask you is, in what way are you more open about it, other than coming on this podcast, in a day-to-day or a month-to-month sort of time frame? What are you actually doing that's making you more open about it? So I'm going to go to the first one. Why are you more open about it now compared to earlier?
So I think in the beginning, I was more, for really no good reason, but I was embarrassed. I think it just felt, which is I was perpetuating the stigma myself, which is ironic, And I always think about this. I'm if it was my patient at work, I would, of course, treat them the mental health the same as their physical health. And then I'm why am I not practicing what I preach? Literally. And I think it kind of just hit me one day where I just felt you can't just say let's normalize it, stomp out the stigma, and then not do anything. It's not you have to walk the walk and talk the talk or something like that.
Yeah, you're gonna walk you can't just talk the talk. You have to walk the walk.
Yes, exactly.
Or
so
I think that's how it goes. Yeah, look, neither of us have any idea, but okay.
Somebody is probably Googling it or like yelling at the podcast, like, guys, you literally just misquoted it, but it's fine.
We're in healthcare. We're not poets. What do you want?
This is true. This is true. But yeah, I think I kind of just felt like also I went through this horrible thing. Like, I'm only 30 and I went through this twice in my life. And I just felt that it needed to have a purpose for me of like, this didn't just happen to me because it sucks and like, great, let's move on. I felt like this was an awful thing that happened to me that is so unfortunately common. And I want someone to benefit from it, or just like someone to know they're not alone, or just that there is help and there is support and it's not your fault. I think that also, I remember the first time with Kira, I just kept saying to Ari, like, I am so sorry. And he's like, why are you sorry? Like you did not, and it's part of the illness itself, like I felt that I myself was causing it, like, and just, yeah, I think just to give those people that voice who otherwise feel that like they're not normal or like they're alone. They're not.
And so my second question was, how practically are you being more open about it? Again, other than what we're doing right now.
Yeah. I mean, this is a big first step.
Oh, okay, good. Fine. This may be the beginning of the journey.
Real.
I like that. All right.
This may be. I don't know. I mean, so after Kira was born and I went through postpartum with her, similarly, I felt this like need to do something. And I found, we were living in the city at the time, and I found that the American National Foundation for Suicide Prevention does these like walks, these out of the darkness walks. And I think it was maybe she was like 1.5. And I was like, let's do it. It's on a Sunday. I think it was like out on Long Island. My parents were able to come. And, I reached out to them and they said like, do you have like a particular reason why you're walking? Like, we love the support. And, they have these like different colored beads also, like if you're walking for someone you lost or like a personal struggle or like all these different things. And they actually ended up bringing me on stage, and I was like the representation of someone with like a personal struggle, and specifically for, and I thank God I didn't have to talk, because I remember like I agreed to it. And then part of me was like, wait, I'm not getting on the stage in front of like Nassau County and like all these people I don't know. And they're like, no, don't worry. Like, we'll just give a one-liner of like you walking to represent those who struggled, like specifically like maternal mental health. And then I think I did the walk maybe like another 1 or 2 times. And then I was probably working like the other Sundays, so I wasn't able to continue doing it. Shout out to healthcare. And then, yeah, I mean, my Instagram is private. So like only people who know me follow me. So it's not like I have this huge platform or whatever, but I think I posted after Leora was 6 months. There's like a picture of me at the pediatrician and shout out to this pediatrician that does the like postpartum check forms on the mom, because that's like also amazing. But, at the 6-month appointment, it was the first time that I felt like not panicked when they brought it out. I remember at like the 1 month or the 2 month, or her, Leora didn't eat a lot. So she had a lot of weigh-ins. They would bring that form out and I was like, I don't want to fill this out. I don't want to do this. Like, and it was the first time, that I filled it out and I was like, oh, like, I'm okay. Like, I'm more than okay. Like, so like I posted about that. And then I recently made similarly, I don't know, just like a reflection, Leora was turning 1 of the year and just how far I've come this year. And with both pregnancies and both postpartum experiences, to just kind of get that conversation out there of like, it's so common and it's not talked about. And like for all the moms that feel this way, like I see you and I am you, literally. And it blew up. Like I got responses. I got messages from people who I went to high school with, who I haven't spoken to in 15 years, or somebody from my like PA school class who I haven't seen. All these, thank God, like such nice messages, which was totally not, not the point of me doing it. I just wanted people to feel like we can talk about this and like we're all thinking it and just not discussing it. So yeah, I think that was kind of my way of, I don't know, being out there about it.
Wow. Ruthie, it's amazing. Really, I think that the fact that you decided to become more open about it, I think is and is going to continue to be very helpful for others. I would predict it's probably going to be very helpful and therapeutic for you as well, even though that's not the reason you're doing it. I think it is going to be a benefit of it. And it is important because so many people who listen to this podcast either have gone through this or might go through this, or even if they don't go through this, they will absolutely certainly know someone who goes through this. It's so common that everybody knows multiple people have gone through this, and just talking about it and recognizing, as you said, the elephant in the room, that it's not really an elephant anymore. It's like a squirrel because it happens so often, right? It's not unusual enough that it has to be an elephant. It really is prevalent, and just that more people understand that it's real. And like you said, it's not something that one has to be ashamed about or feel guilty about. I mean, can you imagine if one of your patients on the cancer floor said, "I'm sorry, I have cancer"? I mean, like what?
I would literally be like, I know, yeah, exactly. That's what I'm saying. It's
you would never think that for cancer, but for some reason, like you said, a lot of people, either themselves or about others, feel that way about mental health. And it's not, obviously, but it's a very prevalent thought. And so I do think that what you're doing is very, very important. And I appreciate it. And I'm sure their listeners do. And if this is your first venture into podcasting, you should do it more because you're really good at it.
Thank you. Yeah, no, I've literally never done something like this before. This morning, I was like, oh my gosh, I'm shaking. Like, I have no idea how to do this. And I mean, you made it like super comfortable. So thank you. And yeah, thank you for having me.
Thank you for listening to the Healthful Woman Podcast. To learn more about our podcast, please visit our website at www.healthfulwoman.com. That's HEALTHFULWOMAN.com. If you have any questions about this podcast or any other topic you would like us to address, please feel free to email us at hw@healthfulwoman.com. Have a great day. The information discussed in Healthful Woman is intended for educational uses only and does not replace medical care from your physician. Healthful Woman is meant to expand your knowledge of women's health and does not replace ongoing care from your regular physician or gynecologist. We encourage you to speak with your doctor about specific diagnoses and treatment options for an effective treatment plan.